you the fifth program in our Sunday Yoga series on the much essential and appreciated theme, Fighting COVID the Yogic Way. We welcome you to the second installment of this program by internationally acclaimed yoga trainer, Miss Ankita Sood, who will be sharing with us essential eye exercises, yoga practices, asanas, and the breathing techniques that can be practiced in our homes. Over to you, ma'am.
Thank you so much, Jaya. Thank you so much. And I'm so happy to see all the health enthusiasts early in the morning. So I welcome you all. I would request you all to please switch on your video so that I can also have a virtual morning with all of you. So I can see Mr. Kailash Kant ji, I can see Prakash ji, I can see Rajesh Nigam ji, and of course I can see the smiling Nagarjun ji. So nice to see all of you. So today what we are going to do is that we will be definitely continuing with our yogic journey. In case you are tested positive, or you can take it as a precautionary session so that you know what you're supposed to do in case you are tested positive. So also in case you have just recovered from COVID, what all things you're supposed to do. So today's session is going to be again a session full of many techniques, many things, specially customized for this topic. I would just request everyone to mute themselves. If Jaya, you can just help me out in that.
Start हो गया. Yeah, ma'am, you can continue. Ankita, ma'am, please
Yes,
go ahead.
yes. All right. So in the last session, what I have told you is that in case you are tested positive, what are the initial steps which you are supposed to do, in which self-isolation is the key to everything, so that rest of the family members are safe and they are not still in the trap. Now today, the session which I just mentioned, wherever you are, in case you are tested positive, you're not feeling that well, you can be on the bed, you can be on the yoga mat, whatever is comfortable for you, please be in that position so that we will be starting this session with the practices today. So please make yourself comfortable. And in between, I will be also introducing some home remedies. One of the home remedies which I'm just going to start with is that you have almond oil. Almond oil. So this almond oil is again very good because this is going to lubricate your nasal passage. As I'm also sharing my own journey when I was tested positive. So the entire nasal passage, it becomes very dry. Also, you feel there is a lot of dryness in the throat area because of the cough. So this is again a very good remedy, which I also used to follow. Badam rogan or almond oil with a dropper. What you're supposed to do is that just put 1 drop each in both the nostrils. So we'll just take the oil like this. Whenever you are dropping the oil, the head position has to be a little lap. So you just have to open the nostril, first nostril, So after putting just 1 or 2 drops of almond oil in the nostrils, you feel really good because the nostril, the passage becomes very moist and you feel much more relaxed. You get better sleep. Your nervous system is completely activated. So you feel really nice. So you must do it. I used to do it in the morning, early in the morning. I also used to do it bedtime. And I used to get very relaxed sleep. So you must follow this. Okay. Second tip, again, I'm just first sharing some home remedies. Second tip is that because this entire process is that your respiratory system is getting affected. Also, oxygen levels may dip. Now, this is a very old technique. This is a very simple technique, old technique, but also followed in the high altitude areas. You know, लेह लद्दाख में इसको बहुत पहले से ही यूज करते आ रहे थे कि आपने क्या करना है, एक फ्रेश क्लॉथ को लेके, फ्रेश क्लॉथ, और उसमें आपने क्या डालना है, अजवाइन. अजवाइन, you can just see, अजवाइन, few cloves या फिर जिसे कहते हैं लौंग, and very few camphor के cubes. Now this is extremely good to increase your oxygen levels and very very beneficial because in case you have a blocked nasal passage, आपको बहुत ही ज़्यादा अच्छा लगेगा जब आप इस पोटली को, this is the breathing potli which I used to say, so ये breathing पोटली को अगर आप use करेंगे, this is extremely beneficial. इसमें सिर्फ अजवाइन है, इसमें लौंग है और इसमें कैम्फर है, और इसको आप अच्छे से मिक्स करके and then you just have to tie it properly. And once you have tied it properly, आप इसको use करेंगे. And use करने के बाद, it is very important कि आप इसको किसी, you're supposed to store it like this. Why? Because we are used to, I mean, we will be using this for the breathing. So it has to be absolutely dirt-free. It has to be absolutely clean. It has to be absolutely pure. So you have to just store it nicely in a proper box. Okay, so fine. So I will be also using this portly during our session, which you can make it after the session and then you can start practicing it. Now we will be starting with the techniques. So wherever you are, what you're supposed to do is just sit down. So I want all of you to please follow me and practice along with me. That is important. So make yourself comfortable in case you are on the bed, on the sofa, wherever you are, or the yoga mat. So everyone, I want all of you to not just watch me now and practice along. So please make yourself comfortable. And how I'm sitting is cross-legged. Cross-legged. Okay? Now, cross-legged. In case you are feeling low in energy, if you are positive, you can just lie down for a while, make yourself comfortable, do something. And if you feel uncomfortable, the key is that you should not exert yourself. So whenever you feel uncomfortable, you want to lie down, you can lie down. So first of all, just make yourself comfortable. Place your palms like this. Place your palms on the thighs. The palms should not be hanging like this, so that the energy is being circulated in the body. So we will be sitting like this. Now, very gently, everyone, just close your eyes and just focus on your breath. How you're breathing in, how you're breathing out naturally. Keep a beautiful smile on your face. The smile is going to work as wonders because you are going to activate all the positive hormones in the body, the happy hormones in the body. Now, take a deep breath in, as deep as possible through your nostrils. And then breathe out from the nostrils. Whatever is your capacity, let it be. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Now, very gently, you may open up your eyes. The first and the foremost thing is your posture. In case you have the tendency of sitting rounded shoulders, then again, you are not using the lungs to the fullest. So it is very important that you keep the posture absolutely straight. I know whenever you are ill, you don't feel because you don't have that energy and you naturally tend to do this. But especially whenever you are spending just 2 minutes, 5 minutes with your system, with your body, with your pranic energy, try that all right. Just for 2 minutes, 5 minutes, I can at least sit with my back straight. And what posture is going to add to this is simple thing. What you're supposed to do is just interlock your hands. Let's do it. Interlock your hands. And slowly, slowly start stretching your arms up. Stretch your arms up. Now, the moment we stretch our arms, what's happening? The intercostal muscles, they are getting expanded. Your diaphragm is getting expanded. Your abdomen is getting expanded. The entire respiratory system is getting expanded. So whatever techniques today we are doing, it is specially to take care of yourself during COVID, post-COVID. So just stretch yourself. Now, the moment you have stretched yourself, your mind should be connected to your lungs. So please close your eyes and try to expand your lungs. Contract your lungs. Expand your lungs. Contract your lungs. Expand your lungs and try to stretch yourself a little more upwards. And as you exhale, try to just relax your arms, but stay there, but relax them a bit more. Once again, breathing in, stretch and expand. And breathing out, relax. Very good. And now slowly get your arms down with a backward stretch. And relax. Now we try to loosen up ourselves. So we'll be doing a quick energizer where we are going to loosen up the muscles and make them very free, make them very relaxed. So we just start with simple movement. Again, according to your capacity, just try to move and move. Try getting your arms up. Keep on moving. The moment we stretch our arms up, we expand our lungs. And some movements to one side. And some movements to the other side. And we relax. Now we relax ourselves completely. And we take a deep breath in. And we take a deep breath out. Now we keep our hands close to our hips. And we give some movements to the neck, because again, neck become little tight, little stiff. So when we breathe in, we look up. When we breathe out, we look down. Here we go, start. Breathe in. Breathe out. Try touching your chin towards the chest. That's going to give the best stretch. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Coming to the center. Now just turn your neck right to the left. 3-4 times. Gentle movements. Keep your eyes open. And come back to the center. Very good. Now we relax ourselves. And what we are supposed to do is, we are going to work on the lungs level by level. What we are supposed to do is, we will be just twisting ourselves like this and feel what is happening to this part when you are just twisting. My head is in the center. I'm not moving my head. I'm just focusing on the twist of my upper body. Very good. Now, I get my arms little more in the center. So that is my shoulder level. Again, I'm just moving them. I'm breathing continuously. And now I take my arms up. So this way, very simple way to exercise our lungs. Please breathe. And now come back to the center. Now, as if we are cleaning the floor. We are cleaning the floor. So please twist and clean. Get your hands on the floor or on the bed, wherever you are. Continue with this cleaning. You're touching your hands down. And now come back to the center and relax yourself. Now, place your hands right here, the intercostal muscles. We will be doing intercostal breathing. Again, very, very beneficial throughout the period. Your forefingers will be in front and your thumb is going to touch at the back like this. The middle finger touches each other. Your shoulders are a little relaxed. Now, when we breathe in, we try to expand the intercostal muscles. I told you last time, What are the intercostal muscles? In between the ribs, we have the muscles. These are called the intercostal muscles. So we are going to expand the muscles. Here we go. Start. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Now relax yourself completely. Take some normal breaths. Allow your body to be completely relaxed. Keep a beautiful smile on your face. And connect yourself with these intercostal muscles. How naturally they are expanding, contracting. Now gently open up your eyes. Whenever there is difficulty in breathing, you're not able to exhale properly. You're not able to exhale for a long time. So we are going to train these muscles to exhale. Now this technique is called as blowing the candle technique. Imagine you have a candle in front of you and you're supposed to blow the candle. So you are supposed to exhale completely. You will be using little force according to your capacity. So how you're doing it, I'm just going to show it to you once. Maximum according to your capacity. Try to just evacuate your lungs. You're supposed to take away all the residual air, the unwanted air which is toxic. You're supposed to take that out. We will be all doing it and practicing it together. Here we go. Make yourself comfortable. Be relaxed so that you will be able to perform better. Now, start. Breathe in. Breathe in. Breathe in. Breathe in. Last time, breathe in. Now, be relaxed, close your eyes, breathe normal. And very gently open up your eyes. Just stretch out your legs. Because if you're sitting cross-legged for a long time, you may feel a little discomfort in the legs. So just massage your legs like this. I request everyone to pin my video so that you can only see me on the screen and it is much more better for all of you. So please do pin my video and start massaging your legs. Massage them nicely. Increase the blood circulation in the body. Massage your toes, your feet. And as I mentioned in the last sessions, that try to squeeze your toes so that the trapped air gets released. Squeeze them nicely. Now squeeze your knees. Squeeze your thigh muscles. Squeeze your hip muscles. And relax. Try to move your legs. Another very important tip is that whenever you are infected, of course you are supposed to rest a lot. So you will be lying down for hours and hours on the bed. But before having your food, after having your food, try to give a little walk to your body. It is very important so that there are no clots in the body. So there are no after effects of COVID. So it is very important that you just take walk inside the room and then make yourself comfortable. All right. Now we again get back into this position. Like this. So we are all now sitting cross-legged, back in the cross-leg position. Another very important technique to take care of our lungs is this technique. What you're supposed to do is, with your right hand, hold your left knee. Your other arm is going to be at the back side in a relaxed way. Now, you try to push your knee down. So this knee, the left knee, continuously you're supposed to push the knee down. We all should practice it together so that you should experience what you're supposed to experience. So please, down, down, down. At the moment you are putting it down, what's happening? You get some stretch here, the intercostal muscles, sides. Now, maintain this, and try to get your chin towards the opposite shoulder, and you touch and you stay. And this movement is very important, so you keep on pushing the knee down. That is going to give you the stretch, and then touch. Push and touch. Keep pushing. Keep pushing. And slowly then relax. This is extremely good to open up your lungs to breathe better. And we change now. Other side. Make a nice grip. Push the knee. This is important. Okay. Push and slowly touch. Push and touch. And slowly come back and relax. Just stretch out your lungs up whenever you get the time. This is very, very important. This was very beneficial for me. Whenever I used to get the time, I used to just expand my lungs and just breathe. And breathe. And relax. Initial stage when you don't feel like even sitting and doing something. At that time, I actually tried to incorporate a very simple technique, but it really helped me a lot. Okay, now I'm going to show you what is that technique. In that technique, because you are absolutely lethargic, you don't want to get up, you just want to lie down on the bed. So what I used to do was taking any cushion or any pillow, and what I used to do was this portion, the lungs, gets expanded like this. I just used to lie down like this, not doing anything, just lying down in this position. Lungs are naturally expanded. They are absolutely free. And then I used to just place my arms at the back side. So there is no restriction in this part. And I used to just breathe and just lie down. This complete area used to get expanded. This area expanded. Breathing was easier. And sometimes I used to just fold my legs. After that, I used to just keep the cushion in the lower part of the back. Now again, this was very relaxing for the lower back because sometimes there used to be a lot of backache. So, like this, and then very gently, some movements. Opening my arms, relaxing. And then gently take out the cushion and relax. Another very, very beneficial asana was when I used to stretch my complete body. This was Yastik asana. So you were supposed to lie down like this and slowly stretching the arms and stretching the toes and full stretch, full stretch. And then gently relax. And again stretching. And then gently relax. Right? Now relaxing again on one side. And then getting up. Now I want all of you to practice these two techniques because I would like to check on you. So please keep your videos on. And first is that pillow technique, because in case you are not doing it in the right way, I will correct it immediately. So please switch on your videos and let me just check how you all are doing it. So for this technique, you all have to get a pillow or a cushion. Get a pillow, Naveenji, get a pillow or a cushion, perfect. Now just keep the pillow or the cushion just under your upper chest, okay? So please keep the cushion under your chest. Immediately you feel the lungs are expanding and you feel that expansion in the respiratory area. Now slowly take your arms a little backside so that the muscles are also stretched. It has to be very easy. Whatever is giving you comfort. This, I customized it for myself and I found excellent benefits. So now just be comfortable. Kailash Kansji, just get your arms a little more down. Yes, like this. Perfect. Nileshji, your arms were good. Little up. Yeah. So make yourself comfortable. The purpose is very simple, that the lungs are open to the best of their capacity. You're able to breathe better.
To the UltraCare Pro user guide series.
Sorry? I didn't get you. Someone was saying something? Okay. So just make yourself comfortable. I'm just watching all of you.
Madam, in between, I was not able to view the video. So can you once again tell me, please?
Should I demonstrate once again, you were saying?
Yes, ma'am.
Okay.
Because I was not getting the video, so
Oh.
I was not able to see the technique.
No problem. I will show. Rest of you just be in the position. In case you have already seen the video, please be in the position, be comfortable. And for the benefits of others who are not able to see, I'm just going to show it once again. So, you have to take the cushion or the pillow, and the purpose is that it has to be just under, just below your upper back. The moment you keep it like this, what's happening? That the entire lungs, it's expanding. And you may keep your arms relaxed like this, so that it's completely open. You may keep your legs straight and relaxed. Or if you feel more comfortable folding them, you can keep it like this. So one was this. Then next I showed them to just keep the pillow under the lower back. It is again relaxing for the lower back. And third, I showed them one asana, Yastika, in which you will be stretching your arms, stretching your legs, full stretch of the body, and then you will be relaxing. And then you will be just taking turn on one side, and then you will be relaxing. Now I am also correcting everyone who are practicing these postures. Okay? So, all right. So, very good. All of you are doing it very nicely. So the purpose is to just breathe. You all are lying down. Now you may shift the cushion under your lower back. You may shift the cushion under your lower back. The second step which I showed you all. Slowly just shift it. Very good. Now you may bend your legs. Please fold your legs. Please do it. Sushil Yadavji, you also do it. Just shift the cushion under the lower back. Very good. Very good. Your legs are folded. So this is very relaxing for the lower back. Because when we are lying down for so many hours, we tend to get some stiffness, some tightness in the lower back. Now, just get your right leg towards the chest. Right leg towards the chest. Very good. Stay there. Very good. Absolutely fine. Kiranji, you're doing it good. Very good, Rajesh Nigamji. Very good, Mr. and Mrs. Verma. Vandana ji, you may also just bend your leg. Perfect hai. Aap ekdam perfect hai. Just bend your leg towards the chest. Very good. Now relax, everyone. And now fold the other leg. I'm not able to watch Meena ji, Mangilal Meena ji. I'm not able to see the person who is down. The person who is sitting, I can just watch her. Very good. Excellent. Now please release the left leg as well. And now you may fold both your legs. Get both your legs towards the chest. This is Pavan Muktasana. Again, it is very good for the abdomen, for the digestive system. You may hold your legs. Kalpana ji, hold kar lijiye. Please hold your legs. Very good. So, double benefit. Head ko, your head is resting on the floor. Please don't lift your head. Very good.
I have a question here.
Yes.
For people who have symptoms like diarrhea
Yeah.
during this COVID, are they also allowed to do this asana?
Yeah, I will just tell that.
They can still do this?
I will just tell that. Let me just get them up from the posture.
Thank you.
Slowly just release your legs. Make yourself comfortable. Release your legs. Keep them folded. And now just take out the pillow from the lower back. Okay. So now this was the question that in case you have diarrhea, again a very valid question, because diarrhea is again another thing which you really have to, aap sab lete rahiye. Please don't get up, just be in a rested position. Listen to me. So when you have diarrhea, that means there is some digestive disorders. There is some problem happening in the digestion. One, you're supposed to have lots and lots of fluids. That applies for everyone. You have to keep yourself hydrated. Number two, very light food like khichdi with some ghee. Absolutely light food. Lot of nimbu pani, lime water, alternative days coconut water. All this thing related to your diet. Coming to the posture. If you have little pain in the abdomen, so now what you are doing is follow that. Stretch out your legs, both your legs, stretch them out. Okay. Your arms are close to your body, Naveenji. Yeah. Now very slowly you may just fold your right leg. Fold your right leg. Arms are down on the floor. Yeah. Now try getting the knee towards the chest. Knee towards the chest without holding it, Kailashi. Head down, head down. So you're just using your abdominal muscles very gently to give a very gentle pressure. It is not a very exerting pressure to your abdomen. So you can do this and then slowly you relax. This is extremely good for your digestive system. It relaxes the system. It increases the blood circulation. Now we do the same thing with our left leg. Hold your left leg. And now release the leg. Relax. Okay, now with both the legs, very gentle holding of the legs also. Both the legs. It has to be very loose holding, okay? We are not tightening the area too much. KC Bhashyaji, now you can hold your legs with your arms, with your hands. This is again relaxing for the abdomen. You're breathing a bit. Very good. Now slowly release and relax. Now everyone stay in the position. I'm going to teach you another technique, which is again very good if you have diarrhea, if you don't have diarrhea. Okay. This is going to relax your abdominal muscles completely. It is called as abdomen breathing pranayam. Please lie down. Suresh Kumar ji, keep lying down. Don't be in a rush to get up. Manoj Kumar ji, yeah. Now, what is this pranayam all going to be about? It is going to be about resting, relaxing, massaging the entire abdominal area. So large intestine, small intestine, your spleen, your pancreas, your stomach, your liver, all these things are going to be massaged naturally. Please fold your legs. Keep your feet on the floor. Naveenji, feet on the floor. Yeah. Knees together. So touch your knees, but feet apart. Knees together, but feet apart. घुटने साथ में हैं, but दोनों पैरों के बीच में फासला है. Right hand on the abdomen and left hand palm facing the ceiling down on the floor. So left hand down on the floor. Okay. KC Bhashya ji, distance between your feet. आपके दोनों पैरों के बीच में अंतर है, but घुटने साथ में है. G, very good. Now, what we are supposed to do is, the way we blow the air inside the balloon and the balloon expands, in the same way, mentally visualize your abdomen like a balloon and try expanding your abdomen when you breathe in. Let's do that. And as you breathe out, let it contract, contract. Continue with this rhythmic breathing. Breathing in, expand, expand. Breathing out, contract, contract. Please continue. VK Verma ji, your knees should be together. Sandeep Srivas ji, try to relax your abdomen. BN Muralidharan ji, you also do it. Everyone should practice it. तभी पता चलेगा क्या हो रहा है. Very good. So continue with this rhythmic breathing. This is going to relax your mind as well. This is going to normalize the pressure of your blood, so blood pressure levels. This is also going to give you very good sleep. So if you have insomnia problem, so continue with this breathing. जब भी time लगे, आप ये कर सकते हैं right on the bed. कभी कभार when the legs are tired, so just open up your legs, everyone. Stretch out your legs. Okay. Now, keep your left hand on your chest. Kalpana ji, stretch out your legs. अभी मैं आपको दूसरा इसका variation बता रही हूँ. Yeah. So, you're keeping your right hand, which is on the belly. It stays there. Left hand on the chest. Shoulders relaxed, elbows relaxed. Eyes are closed. Again, feel each and every breath entering your system. What's happening to your chest? What's happening to your abdomen? This is again very relaxing breathing. Yogic breathing. Continue with this yogic breathing. Very good. Now gently get your arms down, close to your body. I just taught you Yastikasana. I want you all to practice that so that again I can correct you. For that, please keep your feet together. Step by step karenge, Kailashi. Not now. Feet together, arms close to your body, toes pointing the ceiling. That is the first step, the starting position. Your toes pointing the ceiling. Mr. Prakashan ji, don't raise your legs up. आपको मैंने बताया था Yastikasana. We are just practicing that. Now start stretching your arms and take them at the back side of your head and simultaneously point your toes out. Very good. Excellent. You are getting a very good stretch in the respiratory system, abdomen, legs. Please keep your legs down, Suresh Kumarji. Don't raise your legs up. You are lying down on the bed or on the yoga mat with complete stretch of the body. When you inhale, try to stretch yourself a little more, expand. And when you exhale, you relax and now get your arms down in the normal position. Get your toes back in the normal position. Very good. This is Yastik Asana. It is also called as the stick posture. If I'm looking an aerial view, then your body is looking like a stick. Your body is completely stretched out. We will repeat it 2 more times. Start. Breathing in, stretch, stretch, stretch. Get your arms at the back side. Point your toes out. And breathing out, come back. Come back. Last time, breathing in, stretch, stretch, stretch. And breathing out, come back, come back. And relax yourself. So get your arms now closer to your body. Make yourself absolutely comfortable. And rest yourself in Shavasana position. Keep your eyes closed. Again, all these techniques, all these relaxation techniques are going to work wonders because, my dear friends, during, after COVID, rest is the key. You are supposed to give rest and lots of rest. Naturally, you will be healing your body, making yourself completely relaxed. And now very gently, please take a turn on one side. And slowly taking the support of your hand, please sit in Sukhasana position. Make yourself comfortable. Few more things which I really want to add in this session. So I've asked you all to make this breathing portly. How you're supposed to use this breathing portly now, I'm going to show it to you. So this is extremely good. The fragrance of the spices, it's really going to add wonders to your complete system. You feel better, you breathe better. Okay, so what you're supposed to do is, one is very simple, that you just breathe.
Ma'am, can you please again tell the contents of the potli?
Of course, I will do that. So what is inside this potli is ajwain, carom seeds, few cloves, around 3 to 4 cloves or long, and 3 to 4 camphor or kapoor. You have those cubes. Only these 3 things. This is going to increase the oxygen levels. Even right now in the ambulances, they are keeping this potli to immediately give some relief to the patient. And as I also mentioned, in the high altitude area like Leh Ladakh, they use this from years to give the oxygen to the brain. So this is extremely good. You must all have different potlis. Please do not use the same potli for the entire family. You must have different potlis. You must have a proper container to store it so that it is not getting attracted to the dust and it's not getting dirty. The cloth has to be fresh and you have to keep on changing once you feel now the potli is done, the fragrance and everything. So please keep on changing. Another technique is doing anulom vilom with this potli. Again, I'm going to show it to you. What you're supposed to do is keep the potli very close to the nostril, close the other nostril. So I release, I exhale from the other nostril as we do anulom vilom. It works like a magic to your breathing capacity. All these things, because maybe I was experiencing COVID and how I have actually incorporated all those techniques with the yoga techniques. So that's the reason I'm just telling you, please be ready with this potli when we meet in the next session so that you are also able to practice it with me. Okay, so that is again very, very beneficial. So this is one more tip, because I don't want you all to just wait for another week. Another thing which I would really like to mention is the magical breathing, which is extremely beneficial again during this after COVID, is Brahmari Pranayam. So what you're supposed to do is just hum, hum, hum like a bee. Okay, I'm just again demonstrating it once again so that.
Let us do it once round.
Yeah, we will be doing it. Yeah. So let's do it. So make yourself comfortable, okay? And what you're supposed to do is you just have to breathe in. And as you breathe out, you know, in Om we have Ma. So you're supposed to just chant that. Important things. The lips, keep them little away so that it vibrates. Okay, like this. So they are not very tightly closed, not tightly closed, but little distance so that you get that vibration here, inside, here, here, everywhere. You feel that vibration. So let's do it together. Just please, what you're supposed to do with your hands, फिर आपके कान बंद हो जाएंगे, so just watch me. With the thumb, you are supposed to close the earlobe. This is called the earlobe. And very gently, you just keep your hands. And then then you continue. Now I want all of you to do it. Let's practice it. Start. Breathe in. Continue. All right, very good. Now you may just relax yourself, make yourself comfortable. Now rub your palms together. This is called as palming. And make it very warm, the palms. And then slowly you cup your eyes with these palms. This is called as cupping. And then very gently you may open up your eyes with a beautiful smile on your face. And get your hands down. All right. So in today's class, what I have just missed because of, again, time constraint, which I will be covering it in our forthcoming sessions, is the eye exercises, okay? Otherwise, during the last session and this session, we have covered most of the things which you are supposed to do in case you are tested positive or you have recovered from COVID. Definitely, you all must be getting my YouTube links of these sessions, the recorded sessions. So it is a good reckoner for all of you, so that in case you miss anything, you can just put on the video, follow, and practice along. Another thing is that, as I mentioned, steam is very important. Checking your oxygen levels is very, very important. Checking your temperature on a regular basis is very important. Rest is very important. Doing some breathing techniques, what I've showed you, just do those techniques. And don't be hyper कि कुछ हो ना जाए lungs को पूरा दिन ही करते रहे. No, give rest. Rest is again a healing factor. So make yourself comfortable. Early morning, fresh air जब आपके कमरे में आ रहा है, do some breathing, take rest. Lots and lots of fluids, which I mentioned. Early morning, what you're supposed to do is a very good immunity drink. Warm, 1 glass of warm water. Add lime into it, lemon. Add some honey. Add some haldi. And mix it well. And then have it. Sorry. Yeah. So this is again a very good immunity drink that you add lime, honey, haldi, turmeric. Add it well, it's warm, it's a little hot, have it throughout the day. जब भी आपको मन करे आप पी सकते हैं ये. At least 2 times तो आपको ये पीना ही है, because again lime is very, very good as a vitamin C supplement. So that is again very, very important. And rest, I also mentioned about Gargles, again, that is very important. If you have very bad sore throat, you can also use betadine gargles. That is again very good and relaxing. I also mentioned about this Portly. It is very good. Please use this Portly regularly and you feel better. Also, early morning sunlight. So you should have some sunshine on your body. Jahan pe bhi dhoop aa rahi hai, please be close to the window and sit there and just expose the skin to the sunlight. Okay, that is very important. Also, the complete body, wherever it is possible, some sunlight to the face, on the back, on the lower back, all those things are very important. In our forthcoming sessions, I will be also teaching you some yogic massage, oil massage. So that is again going to work wonders on that. Rest, I think any questions, if you have, please feel free to ask me.
Yeah, madam. What about the tej patta ka, water and the lime and lemon water? How does which one you can take first?
Okay, so in case you are having tej patta water, so that you can have it in the morning, वो भी पी सकते हैं, उसको पीने के बाद then you can have your lime water.
Ma'am, I have a doubt. For sugar patients and diabetics, can they have honey is advisable?
No, for sugar patients, obviously you can't have much of honey, but just to soothe up, आप अगर कुछ drops ले लेंगे, so it is okay. But definitely you have to consult your doctor. How is your sugar level according to that? You have to work on that.
Thank you, ma'am. Even dates also is not advisable for them to have sugar patients.
Yeah, because it's very sweet. It is
Very sweet. Thank you, ma'am.
Ma'am, this camphor Portly, should it be taken on need basis? Because there are reports that camphor inhalation is not good for health on a regular basis.
Sorry, it is not good.
Not good. Yeah, it is having some negative effects on the body. Because in Leh Ladakh also, it is temporary relief they are giving. But because I have been going through reports, so scientifically, like medically, there is some that you can recheck first.
Yeah, see, it has really worked wonders for me, because when I used to feel breathlessness, I used to feel very, very comfortable using this. In case you feel you have some allergy with the fragrance, because some people, they have fragrance allergies. In case you feel that, then you may just take out the camphor and use the rest of the things.
Okay.
What are, madam, excuse me, what are the three contents? Camphor?
Camphor, cloves, that means long, and ajwain, carom seeds.
It should be.
Yeah, sorry.
No, it should be raw, no?
Yeah, absolutely raw. Absolutely raw.
Okay.
Yeah.
Thank you.
Yeah.
Thank you.
Ma'am, mostly those who cannot put that posture, like the normal posture of sitting, Padmasan, can we put it like in a Veena, like both like on one side, because I cannot sit. I really feel uncomfortable. I cannot sit in Padmasana.
So Padmasana I didn't introduce at all, because Padmasana is
comfort,
Sukhasan. You're talking about Sukhasan?
Sukhasan. Oh, okay, yeah, sorry, Sukhasan, yeah.
Sukhasan.
So if I am not comfortable or I'm not able to sit that way, like.
See, what happens is, I will just quickly tell you why Sukhasan and why not any other. I will just quickly tell you that. When you are sitting in Sukhasana, your spine is correct, it is straight. When you sit like this, you are giving the body weight, you're shifting the body weight on one side. So the posture is not that good. So another alternative for you is just keep yourself, you may keep cushions according to you feel comfortable. So just make yourself comfortable in such a way. You may just keep cushions, like this. And then you may feel comfortable. Or you may take the support of the wall. You may take the support of anything at the back. So you feel comfortable. Thirdly, don't sit for too long. In between, just stretch yourself, make yourself comfortable, move your legs, give some blood circulation. Because if you will practice it on a regular basis, only then the body is going to Get accustomed to this posture. Otherwise, you will just stay in this posture. I know you will feel good, you will feel comfortable, but let's try. Let's try. Initially, certain problems, but then you will feel better. Okay, Kalpana? All right.
Yes, ma'am. But ma'am, I tend to, you can see like the strain is constantly there on the, like only in one leg I feel. I mean, it's on the right side and it is very, very strenuous. Like I tend to sit backside. My body is pushing in the back because balance I completely lose in one side.
Absolutely. I can understand that. Another alternative is sitting on a chair. Another alternative is sitting on a chair. So you can just keep yourself. So you can do that.
So I just try to sit like in this, like I put that like as you showed. Here at least my back is straight. I don't know, from the very childhood, from the childhood yoga days, I never could sit in the even Sukhasana. Padmasana to bahut dur hai. Even Sukhasana bhi nahi hota hai. So this is the one I was thinking I'll ask.
Correct.
Thank you. Thank you.
What happens is the body is used to, na? Itne salon se the body is used to. He can't sit, can't sit. So let's start, let's stop saying I can't sit. You will sit. You will practice and you will sit. Yeah, yeah, please. Yeah.
Thank you. Thank you.
One more question, ma'am. Hello. One more question, ma'am.
Please tell me, Sanjeev ji, boliye.
Yes, yes. You spoke about gargles. I just want to know, apart from salt, what more should be added in the water?
I mentioned about betadine gargle.
Betadine, right.
So one is salt. One is what I used to do sometimes, adding little ghee, because if you have sore throat and you have that soreness, so you don't feel very comfortable. So just to give that moisture, I used to put little ghee, little turmeric, little salt. And then this used to give very, very good soothing effect to my throat.
Right. Thank you.
Madam, hello. Madam, I would like to know whether all your Sunday classes are getting updated in YouTube.
Yes, sir, they are. And I think the team is going to share the links. Nikalji, is it? Have you shared? Because
it's all available on YouTube. So whoever we have informed them to connect.
All right.
Channel.
Okay, so my channel is Ankita Sood Yoga. You just type these 3 words on YouTube, Ankita Sood Yoga, and you will be having all the sessions, everything as it is. So you just have to put the video and start. Also Instagram and Facebook, you can also follow me there. I have made my very small series of, the journey of COVID positive to COVID negative. So all those things can be.
Thank you, madam. Thank you very much.
All right. So we will be meeting again next Sunday. Next Sunday is going to be more practice. So I would like you all to be on your yoga mats, because we are going to deal with sitting for too long, working at on your computer and sitting for too long. So pain in the neck, in the lower back, all those things will be focused on. So we will be doing all the techniques related to that.
Ma'am, just a small query, ma'am. Just a small query, ma'am. Ma'am, if you see the news, they say that avoid carbohydrates, because during COVID, when you're infected, oxygen the body uses to break those food. I mean, is it true, ma'am, that we should stop intake of carbohydrates? As an Indian, we used to take chawal, chapati.
Yeah. See, again, I would like to mention this. मैं बार बार repeat करती हूँ, but each and every body is different. हम लोग दाल चावल खा के रोटी खा के बड़े हुए हैं, तो हमारी body is more comfortable with that. Especially when you are, tested positive, you tend to feel a lot of weakness, lethargic. Definitely, if you add little bit, आप थोड़ी खिचड़ी खा लीजिए, थोड़ा सा, light फुल्का खा लीजिए, you feel that energy. So बहुत सारी चीजों को भी follow मत करिए. I would just request you all, mind को थोड़ा सा relax करिए. We are watching a lot of news, lots and lots of negative news. कुछ लोग ठीक भी हो गए, उसके बाद कुछ हो गया, अब लगता है अरे हम तो ठीक हो गए, हमें तो नहीं कुछ होने वाला. So let's just be away from all those negativities. Mind को positive रखना सबसे important है. It is very, very important to be away from negative news, negative people, negative emotions. आप खुश रहिए, आप healthy रहिए, you are going to be fine. और बाकी देखिए, जितनी लिखी है उतनी लिखी है, उसके बारे में तो हम कुछ बात ही नहीं कर सकते. The moment we are born, we know इतने breaths आपको लेके जाना है. तो धीरे धीरे breath लीजिए, enjoy करते हुए breath लीजिए, and just stay positive. Yeah.
Thank you very much, ma'am. Thank you.
All right. Yeah. I just saw one question. मैं आपको बता देती हूँ. अगर PI level 1.1 है, कभी कभार क्या होता है कि जब हम लोग जैसे ही इसमें अपने फिंगर को इंसर्ट करते हैं और रिस्ट्रिक्ट कर देते हैं, PI का मतलब है कि आपका जो ऑक्सीजन है वो कितना डीपली पहुंच रहा है. ओके, सो द मोमेंट वी आर जस्ट होल्डिंग इट, तो वो कभी कभार दिखा रहा है, अभी मेरा 11.4 दिखा रहा है, बट कभी कभार आप रिस्ट्रिक्ट, अभी मैंने इसको रिस्ट्रिक्ट किया है, देखिए अभी मेरा ये 1.2 पहुंच गया सीधा. अभी मैं जैसी कुछ मूवमेंट करूंगी 4.7, मूवमेंट 12.5. सो इट इज ऑल अबाउट, हमारा टाइट हो जाएगा, you will feel अगर ये कम हो गया, ये क्या हो गया, so just move your finger a bit and then you will feel कि हाँ better है. Even with the oxygen level, कभी कभार एकदम से दिखाएगा 50, फिर 70, then 99. So relax and just watch it. ठीक है? All right. Any questions, any queries, please feel free. अंकिता सूद योगा, मैं इंस्टाग्राम पे हूँ, फेसबुक पे हूँ, यूट्यूब पे हूँ. You please be connected and सारे links.
One small question.
जी पूछिए.
This we are adding honey to the drinks most of the time. So it is just to soothen the taste, or it is really helping? Because I don't add.
अच्छा. Honey is very 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 beneficial. जो honey bees हमारे को निकाल के देती हैं, वो बहुत ही ज़्यादा फायदेमंद है बॉडी के लिए.
क्योंकि बोलते हैं शुगर भी है, फिर तो I am taking ajwain and सौंफ every day.
Very good.
But you said people say add honey. So is it required or I can?
आप दिन में एक बार कर सकते हैं ऐड, जरूरी नहीं है फुल डे आपको हनी ही लेना है. ओके, सो थोड़ा हनी का कंटेंट लेंगे तो इट इज वेरी गुड फॉर द सिस्टम, प्यूरिफाई करता है ब्लड को, बहुत सारे उसके बेनिफिट्स हैं. तो आप थोड़ा ले सकते हैं, नॉट बहुत ज्यादा. ऑलराइट,
थैंक यू.
सो देन टेक केयर ऑफ योरसेल्फ and God bless you all with good health, and we will see each other again next Sunday. Thank you so much.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am, for this wonderful session. All the participants will greatly benefit from it. Thank you, everyone, for participating in today's session. Stay safe, stay healthy.
Thank you so much.
Thank you so much.
Take care.
Bye.
Same to you. Same to you. Thank you.